Best pre-pregnancy tips for the mom-to-be. Visit your doctor. It is very important to line up an appointment with an experienced obgyn, obstetrics and gynecology, to get a preconception test done. If it is your family doctor, then she may know your family history, your medical condition and your present medication. Based on these facts, your doctor will suggest necessary blood, urine and other requisite tests to be done before pregnancy. Many couples have benefited having done their pre-pregnancy checkup. Besides, the doctor can also guide you on various aspects of pregnancy and what are the common myths and truths associated. A meeting with your doctor can help you clarify your first inhibitions and may boost your confidence on becoming a mother. Know your ovulation cycle. There are more chances for you to conceive if you have an intercourse on your most fertile days. Thus, it is necessary to keep a track on when you ovulate. The easiest method to find out when you ovulate is by keeping a track of your menstrual cycles. If you have a regular menstrual cycle, then keep a track of at least last 6 cycles. Nowadays, ovulation calculator and many apps related to this, available on the internet, can track your exact fertile dates. You can utilize them as well. Start consuming folic acid. Doctors usually prescribe folic acid tablets at least 3 months before conceiving. Folic acid or folate is found in various fruits, vegetables, cereals, beans, enriched bread products, etc. It primarily helps in the production of red blood corpuscles. Ideally, consumption of 400 mg of folic acid is required per day. Intake of folic acid can reduce the chances of birth defect in your baby and also helps in strengthening baby's spinal muscles. Dental checkup. It is vital to consider your oral health before you plan to conceive. When a woman is trying to conceive, a lot of hormonal changes take place in the body and make them more vulnerable to gum diseases. Because of such hormonal reaction, gums may become tender, swollen and red, which might bleed when you brush or floss. Thus, good dental care is essential to avoid oral complications in the later stage of pregnancy. Try to reach your ideal weight. It is always advisable to reach your ideal weight, that is the one which is appropriate as per the BMI. If you are underweight, then you should gain some. On the contrary, if you are on the higher side, then you should try to reduce excess weight. However, crash dieting is not suggested for reducing weight. You should seek proper guidance from your doctor or an experienced nutritionist. An ideal BMI range is given between 20 and 24. Anything above or below this range is considered to negatively affect fertility. Know both you and your partner's family history. It is necessary to learn yours as well as your spouse's family medical history. You should definitely know was there any abnormal, genetic or chromosomal defect birth cases in your maiden and existing families. If you find any such anomaly in the family history, then do consult the same with your doctor. Many complications can be avoided if you become proactive and get the necessary precautions in advance. At the same time, you can also find out if you have chances of conceiving twins based on such information. A healthy diet is essential. When it comes to pre-pregnancy diet care, you should always try to make healthy choices for your diet. Start consuming foods that can provide essential nutrition to your body. It is important to make your body ready for pregnancy. It is a prerequisite to include fruits, vegetables, whole grains, calcium-enriched fruits and lots of protein in your daily diet. Over and above this, enough water consumption is also must. Thus, a well-balanced diet will increase your chances of conception and also ensure a healthy baby. Increase your nutrition intake. Planning a proper diet before pregnancy is very essential. If you are able to understand why particular nutrition is important for your body, then you shall make a proper effort to consume them. Proteins provide strength to your muscles. Carbohydrates provide you with the required energy in your body to perform tasks. Fats are required to absorb vitamins, but try to avoid trans fat. Lastly, fibers help in proper digestion and avoid constipation. Note down in a place the types of nutrition you need to consume and which food provides those. It will aid you to consume the right nutrition. Exercise your body. If you are already following any exercise regime, then it is perfect. But if not, then you should definitely start one. Following fitness routine helps stay healthy during pregnancy. In other way, it can also be a stress buster while you plan your pregnancy. You can begin with an exercise routine, which increases your flexibility, such as yoga, aerobics or even swimming. If you do not have time for any regime, you can definitely consider walking daily for at least 30 minutes. Moreover, mild and regular exercise is also recommended during pregnancy, so an early start may help you. Say no to caffeine. Though it is debatable whether caffeine should be consumed or not during pregnancy, experts feel expectant mothers as well as women planning to get pregnant should avoid or at least lessen caffeine intake. Some studies have found that excess caffeine can lead to decreased fertility and higher chances of miscarriage if consumed in high quantity. It is also suggested not to increase the intake from more than 200 milliliters in a day. A complete ban on alcohol. Alcohol is considered a no-no for women who are trying to conceive. Consumption of alcohol is associated with birth defects, premature deliveries and low-weight babies. There is no safe amount of alcohol suggested for women who are trying to conceive. It is better to completely abstain from consuming alcohol. Consume fish with care. Although fish are considered to be a good source of omega-3 fatty acids and protein, they have high mercury levels too. Mercury is considered to be harmful for the body, and studies conclude that the effects remain in a body up to a year. Fishes like shark, mackerel and swordfish should be completely avoided. If you are a fish lover, then it is better to consume low mercury content fishes while you plan to conceive. Don't smoke nor be a passive smoker. If you are a smoker, then you have a lot of disadvantages while you are pregnant or trying to conceive. Firstly, you might take longer to conceive. Secondly, you might have higher chances of miscarriage. Thirdly, there are more chances to have a baby with defects and various other health ailments. And remember that even passive smoking is equally injurious to health. If anyone in your house smokes, either ask them to quit or make them smoke elsewhere. The stress and be happy. With the intention of have a healthy pregnancy and have a healthy baby, it is prerequisite to lead a stress-free and happy life. One should try meditation and relaxation techniques to overcome any stress in life. A cheerful environment at home and less hectic working environment can really help to lead a stress-free life. Prevent any kind of ailments and infections. It is very important to be in good health while conceiving. You cannot afford to have any ailments. Following certain hygiene requirements is very important when you are trying to conceive and even during pregnancy. You should make sure to wash your hands frequently to keep them properly sanitized. Eat foods that do not have the risk of bacteria. Undercooked food should be genuinely avoided. You should wear gloves while gardening and discarding your garbage bins. Another important advice is to get yourself vaccinated against various diseases. Know the symptoms of pregnancy. Now that you know the pre-pregnancy care, it's also best to understand your pre-symptoms. Normally a missed period, nausea, vomiting, headaches, mood swings, tender breasts and heartburn are common symptoms. If you still are unable to understand such symptoms, then do a quick pregnancy strip test at home with your urine sample. But the best way to confirm pregnancy is to get your blood tested. Check your financial health. Yes, this tip may not be related to your health, but it definitely may affect your health in the long run. When you are planning your pregnancy, it is also necessary to check your financial status. Raising a child definitely means more expenditure to your family budget. If you have not planned your finances, then please plan now, because it might be really difficult to handle financial woes with the growing baby. It is important to know the costs of delivery and treatment at the hospital which you might plan to select. If you have your insurance in place, then do learn in advance what costs they include. And also learn in advance whether the particular hospital that you select is included in the list of the insurance company. Thanks for watching this video. Please like, share, and subscribe channel for more health tips. Have a nice day.